Hello everyone, this is Dr. Kim. It has been a long time since I've had a chance to make a video for this YouTube channel, so I apologize. Since the last time I made, which it seems like it's been over a year, there has been a lot of changes in my professional life. I have left my previous institution, University of Nebraska Medical Center, and have relocated to Houston, Texas. And now I am currently serving as associate professor and director of the imaging center at the UTSD or UT Health School of Dentistry at Houston. Since I've come here, I have been extremely busy, not only due to different teaching and administrative responsibilities, but just to even get to know different types of courses and how this department run and operates is very different. It's really taken me a whole year to get a better understanding of my position requires. But so I'm really glad that I have a chance to now finally kind of come back to or go back to at least what I used to do and share some of the interesting cases that I have had the pleasure of seeing here at the UTSD. So I would like to start out with this case where I have already moved my crosshair to the area of interest, and that is cervical spine C2. And as you can best see in this coronal view, that there is a very well-defined radio-opaque lesion at C2 involving part of the odontoid process and extending left lateral to involve the lateral mass. And as I move the cursor again in the AP dimension, in the anterior-posterior dimension, we see that there is no evidence of radiolucent rim, and also that the surrounding trabecular bone appears normal, and that it seems like it's merging. The borders are merging or blending right into the surrounding trabecular bone. And we can appreciate that in this axial view as well. What you see is that the overall cortical integrity of the cervical spine is maintained, meaning we don't see any evidence of expansion or lytic changes along its border, nor the periosteal bone formation. Now let's also take a look at that area of interest in the sagittal view. So as far as I know, this is an incidental finding and patient is asymptomatic. Having said that, this is a female patient in her 50s. So if I saw this type of appearance in the mandible, without any doubt that I would call this idiopathic osteosclerosis with 99.9% confidence. And truthfully, all the radiographic features that we see, that it's very homogeneous radiopacity, and the fact that I only see it as a singular lesion rather than having multiple radiopacities in the spine, I would still think that we're looking at idiopathic osteosclerosis or dense bone island. Having said that, if multiple of these were found in the cervical spine, I would be very worried for potential osteoblastic, like a metastatic lesion. And this patient being female, metastatic breast cancer is something that we should absolutely consider, in my opinion. So now, what about this patient when we see just one? So that's a tougher question, and I don't know for sure whether we can fully rule out the possibility of breast cancer. But one thing, when I looked at the patient's medical history, I did not see any history of cancer. So one thing that I would ask the patient is whether there is any unusual bone pain in the neck. Also, we can ask whether a patient has had regular mammogram done to rule out breast cancer, and if she hasn't done it, this might be a good time to have that test done. So that's what I wanted to basically share with you, and that's, I think, is the main takeaway point from this unusual and yet interesting radiopacity in the cervical spine. Thank you very much for your attention, and I'll see you in the next video. Thanks a lot.